Welcome and thank you for joining us today. I'm Rachel Lapidus, Strategic Program Manager at the University of California, San Diego, and I will be your moderator for today's Process Palooza. We are so delighted and excited to have you with us. Today, we're going to be discussing UC San Diego's multifaceted response to the pandemic that we call Return to Learn. Please feel free to use the Q&A window to submit questions at any time for our panelists and presenters. This session will also be recorded and placed on the Process Palooza website at processpalooza.ucsd.edu. This webinar also has live closed captioning. You can click on the closed caption button at the bottom of the screen and select Show Subtitles. Instructions are also posted in the chat. And stay tuned for a raffle at the end. It's an opportunity to win a $500 voucher for a select project management or Lean Six Sigma class from UC San Diego Extension. In order to win, you need to pay close attention to today's session. But before we get into today's topic, many teams and sponsors have helped make this event possible, and we'll be thanking them along the way. To start, we'd like to thank our sponsor, Koali Build, a company that allows you to create powerful apps with digital forms and automated approvals without writing a single line of code. Now, today's theme is UC San Diego's continuous improvement journey. So let's begin by understanding how process improvement was at the very center of the work to keep our campus community safe, learning, and thriving during this pandemic. The brief video you are about to see shows where this journey began 1 year ago in 2020 and how process improvement contributed to iteratively solving thorny challenges every step of the way.
The UC San Diego Return to Learn program is an effort to test all students, faculty, and staff in the UC San Diego community for the novel coronavirus which causes COVID-19. The effort begins this summer, where we will test approximately 5,000 resident students, and the plan is to expand this in September, where we'll test the entire UC San Diego community every month. Our team is being led by Chip Schooley, an infectious disease physician who will oversee the testing component, Cheryl Anderson, a public health expert who will oversee the contact tracing component, and myself as an infectious disease epidemic modeler who will develop simulation models to help us understand how to best identify outbreaks and prevent their transmission. Together with a team of UC San Diego clinicians, public health experts, molecular biologists, infectious disease specialists, epidemiologists, and statisticians will work together to develop a comprehensive program in order to best detect outbreaks and prevent their transmission to the UC San Diego community. This summer, we will measure our success by our ability to provide simple and easily accessible testing to resident students. Looking forward into the future, our ultimate goal is to allow the resumption of campus activities so that we can do what we do best: teaching, research, and serving the community. We would like to, together with a team of UC San Diego experts, develop a program that's adaptive, that can continually change due to the changing epidemiological circumstances to help us understand how to best detect outbreaks and mitigate the risk of transmission on campus.
We can't wait to host you here live on campus at some point so you can come experience our enthusiasm for process improvement in person safely. And programs like Return to Learn are what's helping to make that possible. Looking back over the past year, from my perspective, it's been a marathon of crisis management. It has been a year of relentless challenges, and not just with the COVID-19 pandemic. But the Triton community has faced it all together. So what does a university with a culture of continuous improvement do in a year of extreme crisis management? Well, we have a live panel to talk about how the process improvement ethos has inspired and refined UC San Diego's Return to Learn journey over the past year. Remember, you can ask the panel questions in the Q&A module. Joining us today, we have Bob Newhart, Executive Director of UC San Diego's Office for Operational Strategic Initiatives. Also with us will be Dr. Angela Sosha, Interim Executive Director of UC San Diego's Student Health and Wellbeing Services, Dr. Natasha Martin, Associate Professor in the Department of Medicine, Division of Infectious Diseases and Global Public Health. Dean Pham, IT Director of Ambulatory Clinical Systems. Will Ford, Director of the UC San Diego Health Project Management Office, and Erin Crickard with UC San Diego Office of the Executive Vice Chancellor, who will be moderating this panel. I'll hand it to you, Erin.
Wonderful. Thank you so much, Rachel, and a warm welcome to all of our incredible panelists. So we had a similar panel last year, and I was looking at last year's polls, and one of the polls we asked was if attendees would be willing to come to Palooza in person in March of 2021. So obviously last year, I don't think any of us had anticipated using our crisis management skills for this long. Okay, so let's go back to the beginning and see how UC San Diego's journey started. Bob and Natasha, last year we spoke about how all of this was starting. Can you give us a quick synopsis of how UC San Diego's COVID response journey began? Take me back to the week of campus closure.
Sure, thanks, Erin. Well, so the week that campus closed, I'm an infectious disease epidemic modeler. And the first thing I started doing was thinking about how can we use modeling to help predict what would happen in terms of the COVID epidemic and predict how many hospital beds we might need and intensive care beds. And so while I was working on that, a colleague, Professor Chip Schooley, kind of heard about the modeling and approached me really in May to say, you know, we're thinking about what kind of plan we need in terms of the fall to help, you know, reopen campus if that's a possibility, and think about our testing strategy. Could we use your modeling to provide some data to inform what we might need to do? And so taking into account kind of our understanding about the natural history of disease, we developed a very simple model, honestly, in the beginning, that, you know, again, incorporated our understanding of asymptomatic transmission. And it helped us understand that in order to prevent outbreaks, we needed to have an asymptomatic testing program. And we probably needed to test everyone at least every month. So at the scale of, you know, the UC San Diego campus, that could mean 60,000 tests a month. And, you know, it was a week later, we took that very provisional, like early modeling result to the chancellor and senior leadership. And right away, you know, they were on board. They were interested, they were excited, they wanted to know, you know, how they could support it. And as a junior researcher, I was totally floored. I mean, I had never met the chancellor. I had never been in any senior leadership meetings. And here they were kind of embracing the modeling and really being open-minded about potential solutions and potential opportunities in terms of this testing program. This was at a time when, you know, no other university had asymptomatic testing. They were not talking about it. They were saying it's too expensive, it's logistically too difficult. And so at that moment in time, you know, it really was, I think, the really proactive, kind of open, welcoming leadership that enabled this. And it was, you know, a week later that I met Bob and we started this pilot. I mean, it was so condensed. And it was based on this early modeling that we adaptively refined and iterated both the models as well as this whole testing process. But, you know, we weren't paralyzed. We were just enabled and refined. And so that happened with the modeling and the testing. And Bob, maybe you can talk a little. Oh, go ahead.
I was just going to say, and Natasha, you have talked about too, it's interesting dynamics for our university to turn internally to our faculty, obviously, who are experts in the different fields, and turn to their expertise for advice and guidance.
It is great, and it's been great the whole way. And it's not just that they have turned to the faculty, but they've really turned to, you know, the huge breadth of expertise we have both in infectious diseases and public health and modeling and operations all across those domains. And really, again, you know, welcomed anyone with expertise to the table and soaked that information in, even, you know, junior researchers like myself, which has been incredible.
Yeah, and it, you know, the other thing I was going to mention, when campus closed, we still had 5,000 students basically living on campus at that point in time. So it closed, all these people left, and yet we still had a population sitting here that we needed to think about how do we keep them healthy and safe. And so that, I mean, that was also part of the conversation that came into the dialogue And as we looked at Natasha's model, and like you said, I'd never met Natasha or Chip Schooley or probably 95% of the people that I ended up working with intensely over the next couple of weeks. Angela Soshin, I'd never met before. And suddenly we had this conversation that started about this model. And basically the guidance that I got from senior leadership was, is it feasible from an operational standpoint? I mean, basically, is it? That was a question. And then we started thinking about what type of work streams, who would need to be involved in the conversation. And by the next day, I think I heard about this on the 23rd of April. On the 24th, I had written out about 10 work streams of people, of groups who would have to be involved. And by the next Monday, we had our first meeting. And from there, if you're thinking of from a lean perspective, you could break it down to kind of, we're looking at our current state, and then we're trying to figure out our who are we serving here, our true north type of concept. And because everyone's measures of success at that time were departmental, they were organizational typically, and they had processes in place that they followed. And we're bringing in a CLIA, a medical level lab that had very rigorous processes in place that they had to follow to maintain their certifications. And we were asking everyone to come together and do something they had never done before. So it was really, it was that gelling around where we had to go in that true north that really helped us kind of break down the barriers, flatten the hierarchies, and really talk about what had to happen to achieve this outcome. And within a couple of weeks, well, literally 2 weeks later, we were ready to do a pilot, to invite our students to do self-administered testing, and we would observe them in these different locations, but we would not assist them, because part of the model was that in order to scale, well, part of the hypothesis, I guess, was in order to scale, we had to get to this stage where our students and other people that are going to be on campus could self-administer these tests and do it at whatever frequency Natasha's model drove us towards, right? So whether it was monthly or later on in those change. So could we come up with a way that our students and other people that are on campus could tolerate doing this to themselves? Because again, think of the videos that were out there at the time. There were those nasopharyngeal things that you tickled your brain with when you put them and when you used them. So no one was really excited about doing it, and they couldn't even imagine doing it for themselves. So we had to bring these teams together. And feel, again, like I said, if you look at that kind of the A3 framework, we brought everyone together, really started ideating around what would it take to achieve that true north. And then we really refined those work streams. And then we actually rolled out the pilot 2 weeks later. We had people there tracking everything that was happening with tick sheets. And there was daily iteration of changes that had to happen, nightly iterations of changes that had to happen. And there were a lot of changes. We had to make a lot of improvements, but we really were able to move pretty quickly down a pathway from a lab that only had a capacity to do a couple hundred a day, and how we had to get them to where they needed to go.
And in fact, in response to the challenge, to date, UC San Diego's given over 800,000 COVID tests, which is an incredible number. So really quickly, we're going to take an audience poll for all of our attendees. Our poll question is, did your institution utilize process improvement to respond to COVID-19 challenges? Answer yes or no. So did your institution utilize process improvement to respond to COVID-19 challenges? So last year, about 80% of attendees said they discussed process improvement in order to address challenges. Let's see if you used your process improvement tools. And while we're waiting for the answer, Bob and Natasha, how did you initially come up with the infrastructure for the work? For operationalizing everything, the infrastructure. I know you had committees.
Well, we had work streams, but we really looked at what was available on our campus and tried to leverage that. We had an existing CLIA lab that could do the testing. We had to then, as we looked and talked to them, we had to look at their protocols that they had in place and how could you scale those to do what we were doing? How could they actually modify protocols to allow and go to where we wanted to go? We looked at other aspects of the infrastructure for logistics that had to support it. We had a campus logistics group. Could they actually morph, or could they actually add capacity to then manage the processes that we were envisioning down the road, where we would have people We didn't know how exactly we would be doing it, but they would be self-administering these things somewhere on their own, putting them somewhere. And so we're gonna have to have people distributing kits somehow and picking up kits from somewhere. We knew, and then how could we scale whatever this infrastructure was to do that? And this is kind of where we left off at the end of some of our learnings. And so we leveraged all those things and brought these people together, and we've iterated throughout to, I think we're going to talk Dean and Andrew are going to talk about some of that later, but I think we iterated through many different things to go from, to get to a self-administered mode where people could walk up to a vending machine and go down and self-administer and drop it in the bin. And there's a lot that had to happen to get there. And I think that's some of the conversation that'll be coming. Right?
Yes, perfect. So we'll take a quick peek at the poll. So 82% of attendees did utilize process improvement to respond to COVID-19 challenges. That's incredible. It's good to see everyone out there using process improvement. So to your point, Bob, great transition. Angela, Dean, can you talk to us about how student health and UC San Diego Health pivoted their daily operations to focus on the challenges facing UC San Diego students and employees living and working on campus? How did you operationalize all of this?
I think there was embracing the concept that this was now our key health problem. And we had to expand our horizons to think about collectively handling the problem. So that student health had to care for employees, staff, and faculty, not just students. Our partnership with the health system was critical in terms of the lab, as well as human manpower to do all of this work. Because originally it wasn't self-administered testing, it was provider-administered testing and teaching the students, and then eventually the staff and the faculty how to do the self-administered testing. So the health promotion team became instrumental also in creating signage. And, every time we thought we had explained how to do this, we'd send it out that day. They come back, the teams would come back at night with their tick sheets and say, nope, they're getting it confused. We got to re-explain that. We got to change the image. They've got it backwards. And every day, I think we went through 13 sets of instructions in the first set of pilot in a matter of a couple of weeks. And so I think everybody was on board with doing it and willing to redefine their job and just, okay, how do we get it done? And it was great. And the teams, we didn't think of its campus or its health system. It's us. It's all of us together. What are we trying to do?
Yeah. And speaking of which, Dean, you helped with the mobile app. That was a very quick process, very quick turnaround. Can you tell us a little bit about the mobile app?
Of course. So one of the things we wanted to move towards was we knew that the true north, what Bob was talking about, was to get students and faculty and staff to be able to self-administer testing, right? But we knew that was going to be quite a bit of road ahead. So to start that, we wanted our students to be able to identify that this sample was theirs, right? So working with the campus IT team, they developed a mobile app that they put on the UC San Diego app that all students should have already. And that allows them to log in as themselves and scan a barcode to essentially tag that specimen as belonging to them. So when it made it to the lab, we knew to essentially label it with their name and their medical record and their date of birth, so we can get the results back to them. And that process made it much easier, and also gave us the ability to, a few months down the road, to be able to do the self collection testing without observation, right? The vending machine that Bob talked about. And we iterated that app over and over and over again, right? We first started and we realized, well, sometimes like they scanned the barcode, but it didn't take, and then we would get a sample without a name on it. And we're like, well, we can't do anything with these, right? So we had to make the app, constantly improve in the sense of like making green check marks when you scan it, making an X check mark if you scan 2 samples in a day. Or if something happened, if there's we found things like somehow 2 different students would try to scan the same sample. We're not sure how that happened, but we've made errors in that process and made sure that if the second person tried to scan the same barcode, it would stop and would prevent that person scanning it. Because sometimes we ran into those processes when we looked at our, we met every night, right? And we looked at what went well today. And then we found out this was a problem and we worked to fix it, literally the next day or sometimes the following day.
And Dean, I remember last year we showed some TikToks that we had done, new world for a lot of us. to communicate with students. Angela, we've talked about how we had to iterate on the communication with students because students just were absorbing and taking in information through different platforms that we hadn't thought of initially. So we iterated on that a lot, right?
Yeah, our Vice Chancellor for Student Affairs pulled together a dedicated team for student communication around COVID. And we actually went through 4 teams because people were doing their regular jobs, but then they joined the communication team to bring the perspective of various components of campus into the communication to create a student approach. So we used Powtoons, the social media, emails, a really great newsletter that came out called What We Learned with special tidbits, which was really pithy and funny. And the students started looking forward to it because it was just so creative and it was their way. We used it to educate them, but also to just keep them engaged and hopefully give them a little bit of humor in this whole process and confidence that we were working with them and we believed in them and they were going to be able to get us through this, that their behaviors were going to be critical to our success. So I think that communication tool and approach that was very student-centered was very effective, and it was really part of our success story. And we learned how to do that. We would try things too. We'd say, hey, that's not working. Let's try a Powtoons and then see how the students react. And they loved it. And so, okay, we'll do that again. And each time we would constantly be having to adjust because the system changed a lot. I think now we look back on it, we're used to these vending machines and a whole lot. And Will's going to talk about our vaccination approach, but that process of going through a summer, kind of figuring we could do this little mini pilot to then how are we going to bring all these students back on campus? Because we brought lots of students onto campus. How are we going to do move it? We have to test them initially. So we had a drive-through process with tents. Well, the first day the heat started getting into, we had to readjust all the tents because we hadn't factored in how the sun was going to make the work environment. So that approach of always thinking, okay, what's ahead of us? How do we change it? How do we maintain effectiveness was part of the whole process.
This is perfect lead in for our next topic. But before we go there, I'm going to put one more poll up here. Attendees, our poll question is crisis management a part of your job description? And the answers are yes or no. Is crisis management a part of your job description? Last year, when we asked this question, only 22% of attendees said yes and 78% said no. But with that in mind, this brings us to the light at the end of the tunnel, vaccination. So UC San Diego Health at this point has given over 250,000 COVID vaccines, or about 200,000 full vaccine doses administered. Will, you usually work in process improvement in UC San Diego's clinics and hospitals, yet this year you were asked to help set up vaccination clinics in baseball stadium, an athletic facility, high schools, and mobile clinics. Talk about crisis management. How did you adapt your teams to pivot and to set up these clinics?
You know, it's a great question because, you know, it's not just my team by any means. I mean, it's across the organization. I mean, even going back and thanking Dr. Martin, when we first started about vaccinations, you know, and testing and all of that with our healthcare, you know, she helped us with the models of even within our own employees, you know, where should we focus for those high risk employees and such. But yeah, so, you know, the county came to us and basically said, you know, we want to set up a mass vaccination. One of the first ones, at least in the state of California, to set up. And we partnered with the Padres. And this was on a Wednesday. And I remember it, and they were like, we're excited. That's awesome. You know, they're like, we want to do 5,000 cars a day and we want it to open on Monday. And we were, all of us just jaws dropped, right? I mean, like, wait a minute. You know, we don't work on that kind of scale. We don't work in that type of environment typically, you know, so it's, yeah, I mean, they had their tailgate lots, which is these two kind of connected but separate parking lots in downtown San Diego. So again, a challenging environment, very few arteries in and out for these cars to get through. And so, you know, I mean, it was kind of like what Bob was saying. We knew what our goal was, you know, our true north, and we said, okay, we got to get these. We want to vaccinate the communities. We want to vaccinate. You know, we've still had to follow the county guidelines and prioritization. So how do we get those that kind of flow, 5,000 cars through a parking lot a day, with a mandated 15-minute observation period built in, right? So, we worked with our transformational healthcare team, our IS team, our nursing staff, our, facilities, IS, all of these to kind of come together in about 3 days, basically design, bid, construct, fire permit, safety permits, and open up on Monday. And we did about 3,000 cars on Monday, which was a huge success for us, not taking away from anything of the goal. But then it was kind of, a unique challenge in an environment like that, of trying to both standardize the process while design and improve it, right? Because we all know, without standards, there can be no improvement. But this was set up so fast, and it's such a large scale. I mean, we had 150 people, staff members working 2 shifts a day, trying to support this in order to make this happen. And so Monday, that first day, like I said, was really focused on standardization. Let's test the process as it's designed. Let's try to make sure that everyone was working on it. And then our transformational healthcare team was out there doing observations and time trials, calculating takt time. How can we improve this? Especially when you're doing these type of numbers. Incremental improvements have huge results.
Absolutely.
So
Absolutely.
sorry, please.
Let's take a look at the poll results to your point on crisis management. So 22% said yes, 78% said no. That's interesting figure. It's possible that more people will have crisis management integrated as part of their jobs moving forward. But speaking to that, and I would invite the whole panel to jump in, but starting with Will, how do you think that culture of continuous improvement helped you to respond to ever-changing conditions? I would even say not only the pandemic conditions, but you had things like weather and traffic patterns and other things happening near your vaccination clinics. How do you think that culture of continuous improvement helped you to iterate?
Oh, it was vital. It was absolutely vital. I think everyone's openness to ideas, regardless of where they came from. We had field crew bringing ideas. We had IS working on the documentation parts. We had transformational healthcare trying to figure out how can we get one more car per lane, right? And over 12 hours, that's 500 cars a day, right? So just one more car, let's get one more car per lane. Let me shave off 2 minutes of the process. That's another 500 cars per day. And so it's all of these little incremental parts that the whole organization was coming to us. We had staff volunteering out there on the weekends, and we have daily standard and safety huddles in the morning and debriefs in the afternoon, and people are coming up, hey, what about this? I noticed this. We'd love to, I just wanted to share with you this idea or obstacle or something they thought could really improve the process. And that just is, it's both a tribute to, the organizational, the way they think and the way that we see things, but also the willingness and the openness of the organization to accept ideas. This isn't, no, we're doing it this way, a pride issue.
Yeah.
It's open to everyone.
Absolutely. And Bob, you and I have talked about this theme of failing faster, and that sometimes innovation is not just about trying something and expecting it to work, but about trying something and expecting it not to work, but anticipating that we have to learn and adapt. So culturally, how do you think failing faster played a part in our response to COVID-19?
I think it played a huge part. We kind of reset. I mentioned it earlier, once we knew we were headed with our true north, we reset our calibration point of what success was, right? And so you kind of had that target and you were aiming towards, it might be a little bit off target with your outcome, but you knew you were moving closer and closer each time you iterated. And I think our teams really were comfortable with that. They became comfortable with it. And the measure of their success was no longer, oh, my department wants me to do X, Y, and Z. It was, is this program moving in the right direction? And that really helped us. Your success wasn't, it was a failure was a success because we learned from it. And the only failure would have been if we hadn't learned from something, right? And so we learned, we iterated, we got closer and closer, like Will was saying, like everyone said, we never stopped iterating. Now, I do think one of our learnings from that was the people we were serving in some cases were tired of our iterations and they wanted some stability, right? So our students and some of the people on campus were like, hey, can you not change something for a little while? Just we kind of figured this nasal swab stuff out. Can we just stay with that and not go to saliva?
Yeah, that was my next question, Bob. Can we talk about things that didn't work and how you handled them? And it comes to mind because I heard you say saliva tests, and I know that's one area that we've talked about, something that you looked into and didn't go with.
Well, one of the things we continue to iterate and find ways to improve, but I think as we looked at it, as long as we were going towards the health and well-being of campus and that goal again, that allowed us to look at other improvements. And while we, in some cases, rolled them out, we learned this learning, our failing there was that we realized that we really didn't need to roll everything out. It wasn't about the traditional things that you might have seen in a traditional measurement of success would have been, we're going to reduce cycle time and we were going to save some money. And in this case, it was, well, we could save a little bit more time, but our campus isn't ready for us to save more time yet, right? It was kind of that balance point, where it wills down at the vaccination, you want to get more people through. That's your true goal, right? That was your true north. We want to vaccinate more people on campus. Sometimes when we were looking at the testing, we wanted to get more people through. We thought saliva might be easier. We got it. We did validate it. And we decided not to go through with it once we saw people using it, and there wasn't a big excitement about it. And so instead of pushing out something new, we decided to just stay with what we were doing.
Thanks for bringing up some things that didn't work. I love this theme of failing faster too. What were some other things that you iterated on? I throw this out to all of the panelists. And Natasha.
Well, one of the things that I wanted to add that we haven't yet talked about is the wastewater monitoring. So a lot of the discussion until now has been about, we have an idea and we're iterating and we're making small adjustments that, could improve efficiency by a lot. But something that was a little bit different was wastewater monitoring, which was not originally part of our viral monitoring plan. And so we were very focused on, testing and making that easy and accessible and building out this infrastructure. And then it was a little bit later on that we had faculty, again, kind of a group of faculty that were interested in this that said, hey, wastewater monitoring, it's been done with polio. Why can we do it for COVID? It'd be a really interesting way of being able to, test, pooled testing of large groups of people living in a building. And at the same time, we'd been doing a little bit of modeling that said, we might have, the risk of, we might see a greater risk of large outbreaks in our large residential buildings where we have a lot of students living together. How can we reduce that risk in addition to the asymptomatic testing program? Well, if we put a wastewater monitor there that could collect and, test the wastewater and we see a positive signal, then we could maybe tell the students to recommend the students go get tested. This could work, but we didn't know it was experimental. And again, kind of proposed it to leadership. They were really on board. Again, they wanted to learn from the data. Was it actually going to provide an initial early warning? We had started with 2 samplers. We were surprised when one of them actually was positive Labor Day weekend. We had to scramble. Angela can talk about, the scramble, the Friday night of a Labor Day weekend when we actually had to change over students leaving campus and coming onto campus to get everyone tested to 600 people, identified 2 asymptomatic employees, and then it's built from there to 136 samplers collecting wastewater every day, monitoring over 340 buildings. And that was a big incremental change on our original kind of plan.
Absolutely. And when we talk about the culture of continuous improvement, some of these ideas like vending machines, wastewater testing, mobile apps, in a vacuum, in another place, may have been shot down for various reasons. So again, how did that culture play into, let's just try something? Bob, I know that goes back to our theme of failing faster too.
Angela, do you think?
Yeah, I think one of the things that was important, besides this real respect for everybody's voice, and that we needed a lot of voices. We need clinicians and operations, lots of people at this table to get this done, was knowing very clearly from our chancellor what our goal was, what our true north was, having Bob kind of being a ringmaster of all of this, pulling it together. But they also took away some of the financial constraints that I think keep people from making creative change because they think, how's it going to hit my budget? And here we weren't ignoring resources and cost. We were very attentive to it, but we could think, how do we get the job done the most effectively, regardless of whose budget would fall under? And I think opening that creative window and taking away some of the financial constraints really led to a lot of effective thinking and probably very cost-effective solutions, because it wasn't siloed financial thinking. It was solve the problem. What's the true north? What are we trying to do? What's going to work?
Yeah. Will, I saw you shaking your head there as well.
Yeah, absolutely. I mean, it's just, you know, in this process and what we went through and what the campus is going through, I mean, that communication channel was key. I mean, so many changes, so many adjustments, you know, kind of what we're saying is, how do you communicate that out to all the bodies that need to know that, especially, you know, at sites like big mass vaccination sites where you're running 12 hours a day, 7 days a week. I mean, the site managers change daily, the staff and, you know, working their day, so they all need to understand what the new standard is, you know, the new standard work, and but also still that receptiveness to change and the, you know, it's you know, one team working together to solve a problem, not in these silos, worried about the you know, the outcomes of them individually or their team individually.
Absolutely. Just wanted to throw it out to the panel. Closing comments about what was it like to be put on these, flatten out the infrastructure a little bit and be put on these teams and meet people across campus.
I think for me, it was tons of fun, right? Like I've never met Bob before. And I didn't realize this, but a lot of us, because of the pandemic, we met via Zoom. And I actually didn't meet Bob in person until 7, 8, 9 months after I actually met him on Zoom. And that was when we were opening the second mass vac site on campus. And I thought it was really great being able to meet all these different people. And then again, trying to just focus on the same problem and the same solution, right? Everyone had the same goal. It wasn't different departments with slightly different goals, right? It was everyone having the same goal, whether that was get as many people tested as often as we need to make sure we keep the campus safe. And then the vaccination site is, how do we get people vaccinated, right? Shots in arms, right? And then at the beginning, it was like there was a lot of demand, not a lot of supply. So how do we control that? And then as time went along, we then have to start shifting towards the, hey, supply is getting better, right? How do we pump up demand, right? So I think working across teams made all of that a lot easier.
And Dean, I think you and I met in person for the first time at the vaccination station too.
We did, yes, that's right.
Absolutely. Well, I want to thank everyone so much for your participation in the panel, and thank you for all of the work that you've done for our campus, our community, and to model these processes for institutions all around the globe this past year. Thanks once again, and back to you, Rachel.
Well, thank you all. Wow, it is so inspiring to hear about the impacts of Lean Six Sigma to maintain safety and a sense of community at UC San Diego. It's honestly been astonishing to see the commitment of all of you when I hear about coming in over Labor Day weekend to pivot quickly as one of many, many examples, and of the entire Triton community coming together to keep each other safe. Beyond Return to Learn, there are many other opportunities for process improvement on campus. In fact, we are thrilled by the return of the great LSS Race, a competition where Lean Six Sigma practitioners of all levels work in teams to deconstruct, evaluate, and redesign a real-life campus process. Last week, our competitors were hard at work improving processes for study abroad and the Summer Graduate Teaching Scholars Program. I think we'll be able to see a picture, here they are, of some of the competitors from this year's Process Palooza, and you'll get to hear more about the competition next week. They've already made their final presentations to our panel of judges. You'll be able to see these presentations in the coming weeks. Make sure you tune in to see continuous improvement at work at UC San Diego and to find out who the competition winners are. In the meantime, let's turn to a past process owner of the great LSS race to hear about how impactful these process improvement efforts can be. We wanted to welcome a process owner to hear about the experience, the emotional experience of opening up their program's process to scrutiny and improvement, and the impact it has had on their process and on campus. So joining me now is Greg Nishihira, Assistant Director in Facilities Management, Fleet Services. With his new and improved process, he is a star of Fleet Command. Thank you, Greg, for joining us.
Good morning. It's a pleasure to be here.
Thanks. And before we get started, I just want to remind everyone on this webinar that you too can participate in our conversation and ask Greg questions in the Q&A module. So Greg, can you briefly tell us about the specific process that you decided to offer up and what let you know that your process needed a little improvement?
Well, the campus has a need for vehicles. Basically, we provide mobility solutions, and we don't want the scope of the fleet to get any bigger than is required for operational needs of the campus. Vehicles are not cheap, and we have a process in place that vets vehicle requests, and it was not very well implemented. The campus, a lot of colleagues did not know how to request a vehicle, and there were a lot of pain points in our process. And I was approached by a colleague with the opportunity to have our process evaluated. And as you can imagine, I was at first not too keen to this because I think a lot of us don't like to be scrutinized and have our processes, evaluated and critiqued for purposes of being exposed and not being efficient. But I think at the end of the day, we need to look at the big picture and see how the campus can benefit overall and focus less on maybe our internal shortcomings and provide those who are experts, the lean teams in this case, an opportunity to look at everything and provide us with some very beneficial solutions and takeaways.
That's great. So you were able to overcome that sense of vulnerability and engage with the humility of opening up your process to other folks. How did you decide to do that via the LSS race as opposed to with an external consultant or another group?
So we had all of our processes spelled out, and each of the teams, the Lean Six Sigma teams, took a look at our processes, evaluated them, found some of the pain points, and provided some solutions from which actually all of the teams provided some key takeaways that we were able to implement and improve our process. There was a couple of them that were some real gee whiz type solutions that were perfect for helping to improve our process. One that actually is now not only implemented here at UC San Diego, but is emulated at other UC fleets in the UC system as a best practice to try to make sure we have good control over the campus fleets. Reducing vehicles also plays into reducing carbon emissions, and UC has a goal of being carbon neutral by 2025. So all of this, leads to bigger and better things, not just capital cost savings, but also carbon reduction. So there are a lot of benefits.
So you saw impacts in terms of improving the process, making it better known, reducing carbon, so combating climate change, saving on the budget, and showing impacts at other campuses as well. So did you meet your goals? Let me say, did you meet your goals, Greg?
We did. And, the 4-year rolling average of vehicles procured here at UC San Diego was 107 vehicles a year. And in calendar year 2019, which was the first year that we were able to measure the effectiveness of this improved process that we have now, there were 57 vehicles. So the goal is to make sure that, all vehicle requests are vetted. We want to eliminate the low-hanging fruit. We want to eliminate vehicles that are just, wanted as opposed to truly operationally needed. So that equated to about a $1.4 million capital cost reduction in calendar year 2019. There are a couple offsets to that, but at the end of the day, it's well over $1 million.
And I'm assuming that $1 million went back towards other campus operations, towards the campus mission of being student-centered and expanding our research profile and all the other great works that go on in the university. So thank you and your team so much for those impacts.
Yes, I mean, money that's not spent in this area, can be put toward other areas of the campus, and we run a leaner operation, and everyone wins.
So I think as our last question, unless we have some coming in the Q&A, can I ask about whether your experience going through this process improvement opportunity has changed your outlook towards further process improvements within your area going ahead?
Yes, because I'm able to see sometimes we can't see the forest for the trees, right? We see how things are internally, but we don't have a picture of how things, look externally, and we can only obtain that picture by use of other people taking a look at things and bringing to our attention areas that, we may have overlooked, and we can apply these, I've applied these best practices, if you will, to be leaner in other areas of our operation as well. So, not only has this involved a reduction of the number of new vehicles that we procure, but we're also now nudging people into making sure that if they need a vehicle asset, a mobility need is filled by using a vehicle that we currently have on campus. So there are subsequent benefits to the process. And, at the beginning, when I was first approached on this, for this opportunity, my first reaction was, well, now you're going to owe me something in return. But, it's different. It's more now, really, I owe him because of this opportunity to have our process evaluated and scrutinized. And, I think we have to have big shoulders to be willing to accept some critiquing and to make ourselves a little vulnerable. It's a collaborative process, and I think at the end of the day, we all want to do what's best for campus.
Thank you so much, Greg. I really appreciate you being here with us today. So as we've seen, big impacts can come from big projects or from the cumulative impact of many small projects. And next we have an example of a small but mighty project to show that everyone has the ability to create meaningful, impactful change. And here today to introduce us to this special project is Tracy O'Rourke. Tracy is co-founder of the Just in Time Cafe and co-host of the Just in Time Cafe podcast. She is also the co-author of The Problem Solving Toolkit, a surprisingly simple guide to your Lean Six Sigma journey. Tracy is also a master black belt, facilitator, trainer, and instructor, and she's pretty fun too. So over the last 20 years, Tracy has trained over 2,000 people, mentored more than 500 people, and has helped complete over 500 projects with results that range between $50,000 and $12 million in savings. So worth her weight in gold, here is Tracy O'Rourke, who's also a Lean Six Sigma instructor at UC San Diego Extension. Welcome, Tracy.
Thank you, Rachel. So as the Greenbelt instructor at UC San Diego, I see about 100 projects a year just in the Greenbelt program. And I'm really excited that we can highlight at least one of these during Process Palooza. So while you're listening to this healthcare improvement project, everyone, I want to invite everyone to submit questions throughout in the Q&A area, and we'll get those questions answered. I stole that move from you, Rachel. So let me tell you a little bit about Genesis Bojorquez and Lena Thaweny. Genesis is the advanced practice specialist at UC San Diego's Health's Hillcrest Medical Center. Her Lean Six Sigma Greenbelt project focused on improving hand hygiene compliance and decreasing healthcare acquired infections within the Hillcrest inpatient medicine service line. Lena has a master's in public health and is a program manager with the San Diego Regional Center, serving individuals with disabilities. She also earned her Lean Six Sigma Green Belt and applied the tools to improve hand hygiene compliance at UC San Diego Health Facilities. Welcome, Genesis and Lena. How are you today?
Great. Thanks,
Wonderful.
Tracy.
Hi, thanks for joining us and congratulations on your Greenbelt project. Well done. So tell everyone a little bit about your project, Happy Hands Sparkle. Love the title.
Oh, thanks, Tracy. I'm the advanced practice specialist for both the 6 East and 6 West units here at the Hillcrest Medical Center. And so we identify hand hygiene as either washing your hands before entering a patient room, between patients that are in the same room, and washing your hands after leaving the room. And so we noticed that our hand hygiene compliance was actually at 53%. So nearly only half the time our clinical team members were washing their hands appropriately. And so, particularly in the time of COVID, knowing that hand hygiene is the #1 way to prevent the spread of infection, we knew that this needed to be addressed and to look in closely at. And so through this project, we were able to increase our compliance to sustain above 90%. So since mid-2020. And I think that's one of the key takeaways of the project.
So why is it that you think it was only at 50%? Obviously people know that they're supposed to wash their hands, but what was it about it? What do you think was getting in the way or the barriers potentially?
Yeah, so thank you. So through the UCSD extension class that I took with you on Lean Six Sigma, thank you. So through the DMAIC process and the Gemba walk, that's when we were able to identify that we interviewed our environmental services team members and we interviewed all of our clinical nurses. And so we found that one of the primary reasons that hand hygiene wasn't being done appropriately was because our hand sanitizer dispensers were actually empty. And they weren't being refilled. And not that they weren't being refilled, but that there was a long cycle time in order for the sanitizer to be refilled. So, we noticed that it could take anywhere as quick as 30 minutes or up to several hours for it to be refilled. And by empowering our nurses to change it themselves and all of our clinical team members, including unit management, such as myself, that if we noticed that hand sanitizer was empty, we could change it ourselves. And so we were able to decrease that cycle time from several hours to just a minute and a half.
Wow.
Yeah.
So I think what's amazing is when you hear something like that, like, what? They're not washing their hands. Sometimes people get angry, right? Like, I can't believe it. And then you realize that they're actually performing the action and there's no soap. I know I hate that when I go into a restaurant in the bathroom and I go to wash my hands, there's no soap. And then what do, right? It's not like I know where they keep the soap in the restaurant. So I think that's pretty amazing. And the fact that you also identified that it took a long time, we call that changeover, right? We call that setup time. So reducing that amount of time. So did you say it was as fast as 30 minutes, but could take several hours? And what did you reduce it to?
Just a minute and a half.
What? How did you do that? Tell us about the things you implemented. How did you figure that out?
With Lena's help, because she was my team member with the project, we empowered our nurses and clinical staff by providing them with education and training with our environmental services personnel on how to operate the hand sanitizer dispenser, how to change it out. And then we coordinated with our environmental services to know where will we stock our hand sanitizer refill cartridges. And that process alone took probably maybe a month and a half with like the training and education and that sort of thing. And so, yeah, that's really how we did it. And thanks to your class, I figured it out.
That's wonderful. So let me ask, did you encounter any resistance when you were saying to maybe some of the nurses? Because I get it, nurses should be really helping the patients. And did you get any resistance when they knew that you were going to empower them to change out the soap? Were people like, what? No, I don't want to do that. I mean, did you run into any of that? And what did you do if you did?
Oh, so thank you. That is a really great question, because that seems to be something that most people are interested in. But, you know, actually on 6 East and 6 West, so we have a hand hygiene committee just for our floor. And we have hand hygiene champions for our day shift and our night shift. And so I think that probably helps with not encountering as much resistance as some people may think, because the nurses were actually thankful. They're like, you know, if I need to go into my patient's room and the hand sanitizer machine that's right next to the door happens to be empty, I can just change it out myself rather than waiting on someone else to do it for me. And so I think by having champions on our unit to support this change, that helps the most, especially since it was coming from our clinical nurses that are directly on the floor.
Lena, I'd love to hear what your thoughts were about the project. I mean, what did you think when you found out the root cause was that the soap was gone and that you were going to train people how to do all this? What were your thoughts about the project?
Well, so when the project started, I was a little overwhelmed. I was like, wow, we have a huge task. How are we going to break it down? Once we actually walked through the process, we analyzed the data. It was just surprising to see that by improving the hand sanitizing refill process really made a significant impact pre-COVID. So it's just, it wasn't as bad as it seemed, but it was good.
Yes, very good. And what kind of sustainability have you seen over the long term? Have you noticed that people are still using it? And I think you said it went from 52% compliance to in the 90s. Is that right? 93% compliant?
Yeah. So we sustained above 90%. And that's been great since that pre-COVID in 2020 to now.
Yeah. Well, I think what's interesting, and you guys remember in the classroom that we talk about this, how do you measure that? So you guys actually did observations, and we always say, if you can observe it, you can measure it. So you actually watched for the behavior to happen, and that's how you got your measurements in terms of if people were complying. Is that right?
So we utilized a tool that was developed by the Joint Commission. So our regulatory body, they developed this hand hygiene observation toolkit. And it's part of the targeted solutions toolkit for hand hygiene. And so we were able to utilize that as well as their training program to train our champions in how to conduct observations, how to measure, oh, this person did not conduct hand hygiene. Why didn't they? What was the defect to that process for that individual? And we were able to measure that over I believe that was, we did it monthly for, I believe, like a 6-month period prior to this implementation phase to know exactly what are the primary defects as to why it's not happening.
Good, wonderful. Well, I only have one last question for you, and of course it's related to Greenbelt. So tell me, are you still using the skills that you learned in your Greenbelt class? I know that's a tough question since I'm the instructor, and now I'm asking you if you're still using the skills.
Oh my goodness, yes, definitely. I've been using the Greenbelt skills in regards to sustaining this improvement. And so every so often when we do a monthly round of observations and seeing, why our hand hygiene practice is still the way that it is, now our hand sanitizer machines, they're being refilled adequately. So that's not the problem. Now it's the location of the gloves or the location of where our clinical team members can place down medication for the patient, or when they're bringing in items and their hands are full. And ultimately, through this Greenbelt class and program, our culture overall has improved positively. And what I mean by that is, specifically with hand hygiene, it's now common practice that if someone happens to notice someone or a team member who doesn't wash their hands or use hand sanitizer, it's common to hear someone say, oh, hey, don't forget Sparkle. And you know what that means is, you know, sparkle with hand sanitizer, sparkle with soap and water. And I think that's been the primary positive takeaway for me.
Oh, that's
You know,
wonderful,
like
Genesis.
everyone's sparkling. Yeah.
And how about, and Lena, we have one more space for your response. What would you say? How are you using those skills still?
That's a good question. So I don't obviously work in the hospital, so I don't really use it for my job. But it was just a learning experience when I did finish my public health master's degree. But yeah, sorry.
No problem. It happens. It happens. I hope you find usage at some point.
Yes.
Well, thank you so much. The power of what a small idea can do to have an enormous impact is really inspirational. And staff would wash their hands, and now the hospital rate of infection has gone down. So I really thank you so much for bringing your project and sharing it with the Process Palooza audience. And congratulations again.
Oh, thanks, Tracy. Thanks for having us.
All right, over to you, Rachel.
Thank you, Tracy. And I want to say thank you to the Happy Hands team. I want to give you some happy hands. I'm going to remember not to forget to sparkle. That's a great motto for this current day and age and all the time. It's such a timely project, obviously, and a useful reminder, as Tracy said, that we can all make seemingly small improvements that can have big impacts within our own spheres of influence. And now we're about to expand our sphere together. It's time for our interactive session where you can all participate, and Tracy Rourke is going to help facilitate this. So Tracy, did you want to tell everyone a little bit about this activity?
Absolutely, Rachel. Hi, everyone. Again, in the spirit of innovation and continuous improvement, we're going to introduce you to an app called Menti and give you an opportunity to try it out. If you want to watch instead, that is okay too. These fun apps enhance learning and engagement for groups, teams, or students, whether it's virtual or in person. I've seen this app used at both virtual and live conferences to enhance real-time engagement and the experience. So hopefully by highlighting these, we are increasing awareness of the tool and maybe, hopefully, inspire you to try some new things. So in order to participate, you are going to need your phone. And if you need to run and get it, now would be a good time. So using your phone means you'll be able to participate on your phone and view my screen on your computer. The great news is this app has unlimited number of participants. So it's perfect for Process Palooza's many attendees. So go ahead and get your phone, and then you're going to go to the browser and type in menti.com and enter the code 1526338. I'm going to do that now. And I'm going to go ahead and share my screen. All right. Can you guys see that okay?
Looks good, Tracy.
All right. So have you used Menti before, Rachel?
I have. I had the opportunity to use it in the context of presentations of educational technology for some very large classes that we have at UC San Diego. It works really well for increasing engagement in those audiences.
Wonderful. I love it. I'm glad to hear that. I am fairly new to Menti. I wasn't introduced to it, of course, until some sort of virtual collaboration. You know, when COVID hit, I started to get exposure to all different kinds of tools, including Menti. And the hope is that we get to introduce some of these tools through some of our Process Palooza as well. Okay, so it looks like we've got, you can see here, it's called Menti. You can see here that we've got a couple of people clicking in to say that they are actually in there. And I'm just going to give you a brief agenda for this interactive session. I'm going to take a few minutes to explain a little bit about Menti, and we'll do an interactive exercise. And then I'll give you, I don't know if I'll have time to give you a crash course, but we're going to see. So let's see here. All right, we got 60 people joining, as you can see. Menti has got a lot of power. The app focuses on online real-time feedback, as you can see, and collaboration for the education sector in particular, but really you can use it anywhere. It's got polls, you can do a word cloud, and the ability for, like I said before, real-time collaboration. It's been used in classes, meetings, gatherings, conferences, and other group activities. And again, these apps hopefully will encourage you to push your boundaries and try new things and explore different ways to engage virtual audiences. Okay, so it looks like we've got a number of people in there, and I'm going to see if you guys are ready. All right, so go ahead and type in, are you ready? Select the interactions on your phone. So look at your phone. It's asking you a question, and you can type in if you are ready. You could do a heart. You can do a thumbs up. And let's see what this app can do, shall we?
I love all the positivity coming in here, Tracy. All the thumbs up and hearts. I need this in my daily life.
All right, so again, look at your phone and answer the question. Have you used Menti? It's actually Mentimeter, but then you have to go to Menti to actually do it. And you have a couple of choices. And have you used it before as a facilitator, as a participant, as both, or you haven't used it yet? So go ahead and select that and then submit your response. And you can see it's building. So we've got 88 people trying it. Only 1% have used it as a facilitator. 68% have not used it. But after today, you're going to be able to say, yes, you've used it. Now, Rachel, have you used it as a participant and a facilitator? What's your answer?
Well, never as a facilitator for me. So I would be with that 22% who says yes as a participant.
Very nice. Okay, very nice. Look at that. So we've had 96 people respond, as you can see with the little people on the bottom right. And this is the breakdown. This is called a pie chart. I'm sure most of us know that. I teach that in class as well. But looks like a lot of people need more chances to be a facilitator someday. Well, let's go to the next question. Okay, so this is a ranking. So what it's going to ask you is, what is your favorite Tuesday? And you have to rank them in order. So obviously your favorite Tuesday could be Palooza Tuesday, or it could be the Tuesday before Palooza Tuesday begins. That's the, I love the suspense part. Or it could be the Tuesday after a Monday holiday, or just an ordinary regular Tuesday, because, you know, it's predictable. You know, it's not bad to say that it's ordinary and regular. A lot of people do like that. So go ahead and select your options and you can type them in and we'll see what this is looking like. I don't know, what would be your favorite, Rachel?
Well, I'll tell you that I do enjoy suspense. And a typical week, my favorite day is actually Thursday. I realize that's not the question because of the anticipation of the weekend. So I think I would go with the Tuesday before Palooza Tuesday. Extra time to prep, learn, and get ready for that Palooza Tuesday session.
Yeah, definitely. I love it. And it looks like we've got about 81. It's still climbing. Palooza Tuesday is the first, and that's why they're all here today. An ordinary regular Tuesday is second, and that is great because, again, people kind of like things to be predictable throughout the day. We often don't like, we've talked about this in Greenbelt, we don't like variation in our processes. We like variation in our food choices, potato chips and stuff, but, we kind of like some predictability in there. And then third is the Tuesday before Palooza Tuesday. And lastly, the Tuesday after a Monday holiday. Yeah, that'd be my fourth choice too, because it's kind of a bummer going back after you've had Monday off and you got a boatload of work and a short week to finish it, right? Mm-hmm. All right, good job, everyone, for participating in that. Let's go to the next question. Okay, so this is a word cloud. So the word describes, you want to pick the word that describes what you hope continuous improvement will achieve in your organization. Just type one word. What might that word be? You can see the word cloud building as people type in those words. Oh, I love it. So the bigger the word, the more people that have written that out. So you can see efficiencies getting huge. And peace is actually a big one too. And
someone said pizza in there. I'm real curious about that. Is that a pizza maker or someone is being plied by pizza? It's a small one, but
pizza value. Somebody wrote, "Hi, Mom." I know we all get our 15 seconds of fame. So this is really nice. We've got about 80 people in there, and it just reorganizes the words for you. So this is a great application. I've seen this used in a lot of ways. I've seen it used for team builders, for feedback on a session, or, what do you think the purpose of a group is? Those kinds of things. Rachel, have you seen the word cloud used in the past?
Yes, absolutely. This is also in the context of courses. It's well used to say, what topic did you best understand today? Or what do you want to learn more about? And it can help guide future conversations or discussions around those ideas.
Yes, very, very cool. Good team builder as well. All right, nice job on that. We had 94 participating. Okay, so let's go to the next builder here. Okay. So this is a question that you're going to do. We got 85 icons here. That means 85 people are ready for a quiz question. So how this is going to work is, as soon as I hit it, the countdown button, it's going to ask you a question and you have to answer it with the correct answer. This is a competition that you can win. You're going to get points if you are the fastest person, as well as the correct answer. So I'm going to go ahead and start the countdown. Be ready. And remember, fast fingers wins, and correct. Go. Okay, we got answer fast to get more points. Okay, UC San Diego, how or why is UC San Diego implementing continuous improvement? Time's up. Okay. Okay, we have a lot of people that have put in, 45 people said all of the above, followed by be more efficient in support of strategic goal number 5. And guess what? The answer is all of the above. So let's see who the winner is, shall we? And the winner is, oh, here we go. Mars, no, wait. And Mars wins 994. Who the heck is Mars? Nice job. Whoever you are out there, we got fun names and fun icons. Very cool. Okay, nice job on that. So how do you guys feel about Menti? This is your last response. This rocks. It's okay. Brain overload, or I'm not sure yet. What do you think, Rachel?
I mean, I think it rocks, but I'm a little bit of a nerd for this kind of stuff. So I respect all opinions.
All right, wonderful. And we're still having people, and that's 90 people. So a lot of people do like it. 69 of 92 have said this rocks. 19, it's okay. Do you like that? That's perfect for a cat, isn't it? Brain overload, nobody. Well, that's good, because I think when we all had to go virtual, we all had a little bit of brain overload with some of this stuff. And not sure yet. Yeah, that might mean that you have to work on a little bit more, and that's okay. All right, so, and thank you for participating. So that is our little Menti exercise, interactive exercise. So we hope you liked it. And I'm going to go ahead and go out of my presentation here. I don't think we have time for me to do a little mini crash course. So I'm going to just hand it right over to you now, Rachel.
Thanks so much, Tracy. Well, we're just about at the end of our session today, but before we end, now is the time for another competition. It's a raffle. Get those fast fingers on those happy hands ready. We will have one lucky winner of a $500 voucher towards a project management or Lean Six Sigma professional development course, courtesy of UC San Diego Extension. Here are the instructions for the raffle. So I will give you a question to answer. The chat function, not Q&A, the chat. The chat function will open for answers to be typed in, and you will type it into the chat window as fast as possible. Then the chat window will close again, and the fastest person to type in the correct answer is the winner. So in about 3 seconds, the question will appear, which I will then read, and you will quickly type. We ready? Okay. The question is, what did the Return to Learn panel say kept their continuous improvement on track? Paul, it was not pizza. No. Okay, so while we're waiting for the winner determination, we wanted to make sure to mention our bonus session this Friday on process landscape, forging your path through dense process jungles. The session will be brought to you by Prachi Raheja, Lean Bench Manager from IT Services at UC San Diego, where you will learn a technique to consolidate and communicate information about the business processes across a large business area in a cohesive way to build a solid foundation to prepare adequately before embarking on the journey of process improvement. And you will be introduced to the applications of this technique for process evaluation and intentional process transformation. So there will be shortly a link in the chat for more information about this Friday's session. And I think shortly we will have information on who the winner of the raffle is. Should I drum roll? Okay. The winner is Mona Zarai. Mona, congratulations. I hope I pronounced your name correctly, and I hope that you take great advantage of that course for Greenbelt or other project development, project management. And now I have to reflect on what we've experienced so far today. It's been packed. We heard from key leaders about UC San Diego's continuous improvement journey. We got an update from the Process Palooza competition. We heard about the Happy Hands Sparkle. I can't not do this. The Happy Hands Sparkle project from our nurses at UC San Diego. We got to participate in several fun interactive exercises. And we had a lucky audience member, Mona, who won a $500 voucher to help take her on the next steps in our continuous improvement journey. And I'm afraid that's all we have time for today. But I do want to thank everyone for your participation in Process Palooza. If you want to share or review what you learned today, we will be posting a recording of this presentation on processpalooza.ucsd.edu. And I want to thank again the presenters and guests for sharing their time and insights with us today and inspiring us to think big and small about the ways in which continuous improvement at all levels can lead to real impacts. We encourage you to complete the post-event survey that you will be sent shortly to help us continue to improve our event, practicing what we preach. And that's all for this week's Process Palooza. Please be sure to join us next Tuesday, May 25th, where we will be discussing lean in higher education. We will be joined by University President and lean author Bill Balser from the University of North Carolina, as well as colleagues practicing lean from University of Canberra in Australia, University of Tromsø in Norway, and University College London. And lastly, we'd like to thank our sponsor, Koali Build. No-code platform Koali Build is empowering individuals across UC San Diego's campus to reduce process waste and free up staff time to concentrate on value-add activities. Put the power of process improvement in your happy hands with digital forms, approval routing, and customizable email notifications. Turn your Lean Six Sigma vision into action by creating powerful, secure, and mobile-friendly processes, all without writing a single line of code. Learn how other institutions streamline processes on their campuses today by visiting build.koali.co or the Process Palooza website. And it's been great building with all of you. Have a great afternoon.